This podcast is for general information only. It is not intended as a substitute for general healthcare services. If you have medical conditions, you need to see your doctor. Use of this information is at the user's own risk. Welcome to FitRx with Dr. Greg Dennis. Join me as we challenge the standard sick model of healthcare. This is your source for everything health, wellness, prevention, fitness, biohacking, and more. Hello, everyone. Welcome to another edition of FitRx. I'm your host, Dr. Greg Dennis. I'm joined today by another physician. So lucky to get a lot of physicians on here. And this is another one that I met at the Age Management Medicine Conference in Miami, Florida, here a few weeks back. Her name is Dr. Carolyn DeLucia, MD. She is a board-certified OBGYN, has been a fellow since 1995 and has kind of become an expert in the field of sexual medicine. And she has kind of expanded her practice into aesthetics and specializes in rejuvenation and anti-aging. She has a clinic called The Secret Orchid. Actually, sounds like she has several clinics, which we'll talk about. And we'll just talk a little bit in general about what she does. But, specifically, she gave a lecture on something called exosomes, and more specific, autologous exosomes, which we will talk about what that is. But it was really one of my favorite lectures because it was new to me. And just by the end of it, I thought, I gotta do this, and I got to incorporate it in my clinic. And so I'm excited to learn more about it, just not only today, but in the near future. And so Dr. DeLucia, welcome to the show.
Thank you so much. It's an honor to be here. Any opportunity that I get to make people aware of the wonderful progress in medicine and the tools we have at our hands to slow down aging and improve longevity. We're living to 100 these days. We may not like what that looks like right now, sitting maybe in a wheelchair, drooling with something making our heart continue to beat and make our kidneys function. We got to improve that and make sure we could live with quality if we're going to live that long. And we better be able to have sex, because why live?
Yeah, there you go. Well, that's a perfect segue into my next question. When I have physicians on the show that do, anti-aging type stuff, I always like to ask them how they got into it. And I have not had very many gynecologists on this show for whatever reason. I think a lot of that reason is gynecologists just kind of tend to stay in their lane, gynecology, but you have branched out into the anti-aging field. So talk about how that happened for you. How did you get involved in that?
Oh, I'd love to. Well, we're going to be going back quite a ways to 2002, when my eldest daughter was 10 and she had a piano recital. I had a woman in labor, and I knew she had that piano recital. I knew that I had to be there. And my very astute 10-year-old said, "Mommy, if I don't see the white of your eyes, I am not getting on stage." And I said, "I'm going to be there. I have coverage. Don't worry, honey. I'm on my way." And my woman was 8 centimeters. She was a multip. I figured she could push that baby out. And my superwoman cape came out. And I was going to catch this baby and make it to the conference and her concert. I missed it by 5 minutes, and she did not get on that stage. So with that, I said, I need to change my life. I need to make changes that will enable me to and control me from making those kind of choices where I chose my patient and my career over my own child. And I felt that if I didn't make a change soon, it was going to affect my children's lives. So I stopped obstetrics, and I was doing GYN only, and my income was dropping. And at that point, having been the breadwinner in the family for many years, my ex-husband said he wanted to see what I could do to supplement my income, and he discovered Botox. Botox at that time was just coming to market for cosmetics. And I jumped into the field of aesthetic medicine. Once in that field and having a knack for it and enjoying it and it doing just that, supplementing my income, it's difficult to learn how to take cash as a physician who's used to being paid simply from the insurance companies and having heard patients complaining about their copay for 20 years. But that being said, once you get over that hurdle, you realize that the same patient who's going to argue about a $20 copay will turn around and drop down $2,000 for either their cosmetic aesthetic for their face and or sexual improvement. So once you're past that, you're on your way. And I was blessed in 2013 to have one of the laser companies identify me as a gynecologist who understood lasers, come to my practice with the very first device that was for female intimate health. And that laser works by causing increased blood flow and new collagen. It improves urinary incontinence. So once I discovered that there were devices that could actually improve women's functional status, then that are aesthetic in nature because of the technology used, I was all in. And the rest is history.
Okay, well, very nice. And so you've been doing now kind of anti-aging aesthetics and stuff for how long?
Since 2002.
Since then. Okay, wow. All right.
Yes.
So you were really
Yes.
kind of probably maybe one of the pioneers in the field, I guess, of this anti-aging movement.
Exactly.
Okay.
I actually was. I was there as this entire field, functional medicine,
Mhm.
evolved. And luckily, I have friends in the area like Dr. George Shapiro, who has been doing this kind of work for many, many years as well. We've been friends since medical school. And he also has been involved with Cenogenics and et cetera. And what we've ended up doing is with the event of Fountain Life, which is a company that grew from Tony Robbins' book Life Force. It's a longevity clinic that works on a membership model.
Mhm.
And I joined their in their early stages. I was with them as their intimate health specialist. So that was very, very rewarding and an exciting place to be. And it's just a wonderful world, what we have and how we can take care of our patients and improve their health, bioidentical hormones, peptides, you name it.
Okay. Well, talk, I guess, in general about what you do and some of the things that maybe can improve sexual health for men and women, and then kind of leave exosomes for a minute because I want to dive into that a little bit deeper. But I know you do PRP and which I've talked about that on the podcast before. But talk about some of the things you do, how they work, what you like about them, and just so people can get an idea of what's out there.
Okay, so there are energy-based devices and regenerative procedures, and there are surgeries in intimate health, both for men and women. So, in evaluating a patient who comes to me with the complaint of sexual dysfunction of any kind, if they're unable to have an orgasm, or if it's a postmenopausal woman with severe vaginal dryness and inability to tolerate penetration, There are many ways to assess. First of all, full exam. And I always begin with an extremely extensive set of blood work, a little bit more than your routine physician, as I'm sure you do as well. And I evaluate what can be going on hormonally, any other types of influences, vitamin deficiencies, gut health, the whole realm. And then dive into what are the options. And I always speak, let's say for a patient with vaginal dryness, I will speak to what has been available no matter what physician they go to. So if they're involved with a routine traditional gynecologist, I will suggest that at that physician, they may get local estrogen or local DHEA to help with that vaginal dryness. Then I'll speak to what's new. And what's new in this realm for women are lasers. Lasers will treat the full length of the vaginal vault, increase blood flow, collagen, and elastin, or you could use radio frequency, which is another energy. And the newest energy in this realm is low intensity extracorporeal shock wave therapy. That energy is truly remarkable, and we're only scratching the surface of what this type of energy will be able to do. It can penetrate 13.5 centimeters into the pelvic floor painlessly, totally painlessly, and externally without any movement. It's very comfortable for the patient as well as the provider. And it's going to create new blood flow. So the device I use is Duo, which is by Alma Lasers. And this device is both for men and women, as the name suggests. It's fantastic for erectile dysfunction in men and anorgasmia in women. So I've been doing the clinical trials on that for women, which was never used before in that realm. And it's just astonishing, the results. So that's a little bit of what I do in addition to PRP. I was right after I started in the laser realm of intimate health, which was in 2013. I started looking at what else is going on. And I discovered Dr. Charles Runnels in Fairhope, Alabama, as you did. Took 2 planes, a train, and an automobile to go see him, literally. And when I got there, what he taught me was incredible, life-changing, as PRP we have discovered certainly is for intimate health as well as aesthetic health. So it's just a wonder. And then the regenerative world has evolved.
So, as I mentioned, I do some PRP, so very familiar with that. And then now exosomes. And again, that's what was kind of new to me. Talk about, I guess, first, just describe what are exosomes and then maybe how you discovered them. And then we can maybe talk more about kind of the clinical applications and some of the results that you've seen and that type of stuff.
Well, I will tell you that I've been speaking about exosomes since 2017. And with that, I have been confused myself. So I have recently put together a lecture to simplify and to help physicians, let alone patients, understand what we're talking about. So exosomes are small vesicles that come off of our cells. Almost any cell in the human body can create exosomes. They are anuclear. They do not have a nucleus. They do have a cell membrane, and yet inside they carry, most commonly, microRNA and messenger RNA. And these exosomes can be isolated from a patient, from a plant, and I'll get into that in a second, and used to help regenerate and anti-inflammatory processes. So what they actually have, these little microRNAs and messenger RNAs are like a little letter being sent from one cell to another. And it will tell the next cell what to do to create a protein or not create a protein, replicate or not replicate. And that is what an exosome has the capability to do. We, in the field of regenerative medicine, have been able to, by size, isolate and concentrate the non-inflammatory type of exosomes, and that's what has hit the market. In the United States, the market in aesthetic medicine has absolutely exploded with exosomes. There are 4 general sources of exosomes on the US market. One of them is plant, and aloe is one of the plants being used. Another is adipose tissue, and this is from a cell line in Korea that they replicate that cell line and extract the exosomes. Then there's a product on the market that is pooled human platelet exosomes. So several patients have donated their blood, their platelets are extracted, then their platelet exosomes are extracted and pooled together. That product's actually from Mayo Clinic. And the 4th is fetal origin. Fetal origin is either placental amniotic fluid or Wharton's jelly, which lines the umbilical cord. So in my opinion, I do favor fetal exosomes just in case there's any antigenic response whatsoever. This is so new that all these products that I've mentioned so far by the FDA can only be used topically. But I will also say, very interestingly, that a typical exosome is ridiculously tiny. So it's 40 to 200 microns. That's it. 40, 50, 80, up to 200 microns. A hair follicle is 40,000 microns. So if you hear what I'm suggesting, simply applying an exosome topically to the top of your head, you can get benefits of exosomes being absorbed into your hair follicles. Fascinating, just fascinating, as well as putting it on your face. And it's not illegal to apply it post aesthetic procedures such as laser treatments, resurfacing, Fraxel, any of these devices, microneedling, all of these devices that are being used can be enhanced by applying one of these topical agents. But what we do know as well is from other countries, because we're not allowed to do it here, that exosomes with these little messages may be a backdoor to our stem cells. And it actually may be one of the major ways that stem cells are functioning is by, when we isolate stem cells, we're actually isolating exosomes as well. So there's theory that that's how potent and what potential exosomes have in regenerative medicine.
And so what these are doing on maybe like a cellular level, you talked about, they're having these messengers, and so
Hmm.
are they just stimulating a regenerative process? I mean, is that kind of what they're doing with
Yes,
these
they can.
messengers?
What we have clinical trials showing is that they increase collagen, they increase elastin, they increase angiogenesis, as well as decreasing inflammation overall. So the fact that all of these can only be used externally is somewhat frustrating because there are bigger fish to fry than making someone grow hair or someone look younger. We want to feel better. We want to decrease. Inflammation is the killer. Inflammation is what leads to cardiovascular disease. It's what leads to aches and pains. So what can we do to get these exosomes intravenously or intraarticularly? And that's where the autologous exosome comes into play. And what that means is that it is the patient's own exosomes given right back to them. And that obviously eliminates any concerns about antigenicity or reaction, foreign tissue reaction, so to speak. And because it's the patient's own, it's similar to giving a blood transfusion or giving a patient their own PRP. Therefore, it is not restricted by the FDA and can be used by injection.
Interesting. Well, let's talk about some of the clinical uses for that. And so let's talk about some sexual health first. Maybe say in a male, again, traditionally I have used just PRP shots where we
Mm-hmm.
just for the patients that don't know what that is, we draw your blood, we basically extract or concentrate the platelet-rich plasma. We call it PRP, and then we inject that back into, whether that's a joint. If we're dealing with sexual health, we're injecting it in the penis.
Mm-hmm.
So in the case of exosomes, we're sending that off. There's a company that does that. They are extracting the exosomes. They send it back
Mm-hmm.
frozen, and
Mm-hmm.
then we now take these exosomes. And I'm assuming in a male, we're just injecting those exosomes directly into the penis. Is that correct?
That is correct. That is correct. And you can mix it with, if you so desire, mix it with PRP. You can put it directly in itself. You can also just extend it with a little bit of normal saline so you have a little bit more volume, because it will come in a 1 cc vial of exosomes. And these exosomes are, let me just quantify this for you. It is somewhere around 400 billion to 800 billion exosomes per vial.
Hmm.
And the ability to give that back to the patient is beyond exciting. So our preliminary data, for example, on an osteoarthritis study, where we use something called a WOMAC score, which is a simple questionnaire that a patient takes to quantify their pain prior to the procedure. And then they are offered either to have the autologous exosomes given intravenously or directly into their most inflamed joint. And they are then given the questionnaire again in a month, 3 months, 6 months out to see what results they have in diminishing their discomfort. And what we're seeing is, believe it or not, that the IV administration seems to have better pain relief and anti-inflammatory response than simple directly into the joint. So it's just mind blowing. I guess basically what we understand is that exosomes have honing devices, and they'll go to where that inflammation is in your body.
Wow. Do we know? So obviously, it has a lot more benefits than just sexual health. You're talking about injecting it intravenously.
Yes.
You mentioned looking at it at 6 months. Do we know how long do we know? A year later, how long is that going to last?
We don't have that data yet. It's that new. So
Okay.
we're out about 6 months and still having response.
Okay.
I'm one of those people. I had excruciating pain in my right shoulder. I'm 62. Things hurt.
Wow.
They begin to break down. So this shoulder was very uncomfortable in my sleep. And wherever I placed it, it would wake me up easily up to 4 times a night. That has not happened yet.
Hmm.
And I'm out 6 months from the IV injection of my autologous exosomes.
And this is
I,
just a simple one cc IV push
that's
of the
correct.
exosomes. Wow.
That's
Yeah,
correct.
that's impressive. Other than
Unbelievable.
than pain, osteoarthritis,
Mm-hmm.
gosh, I guess if we're
Mm-hmm.
talking about inflammation, I mean, the clinical utility of this could be about
Here's
anything.
a really funny one. I did the exosome P shot for my boyfriend, and we are, I think, a month out now. In addition to the benefit of having enhanced sexual function, he's saying to me, I think I'm having less aches and pains. He said, do you think that's possible? And of course it is.
Hmm.
Why? When you inject exosomes into the corpus cavernosum, I did not use any kind of a ring to keep it there. When blood goes in and out of the corpus cavernosus, obviously it's going to mix with our regular vascular system. So he may be onto something as far as
Hmm.
not only getting sexual benefit, but full systemic benefit.
Interesting. Wow, that's incredible.
It's
Well,
incredible.
it really is. So back, I guess, to the sexual health. Talk about, I guess, you've probably been doing PRP for a long time. How long have you been doing the autologous exosomes?
The autologous exosomes are 6 months now.
Okay. So talk about, the results you've seen
Yes,
with that versus just PRP, and it sounds like you're doing more of a combination in both. Do you do that every time, or do you sometimes just do the exosomes?
I do it every time.
Okay.
I do use it also in women. So women have the O shot,
Hmm.
and that is injecting the PRP into the clitoris and the G spot, mind you, painlessly. I want to make sure our audience knows that we have this down pat in making this minimally at all, with minimal discomfort, as you well know. So PRP, I'm going to quickly say that it's like the magic yellow goo that comes out on our knee that causes the scab falls off. We have no scars. Just to give people the idea of what PRP is and its ability to regenerate tissue. It has growth factors. It calls our stem cells to that area to regenerate new tissue. And we've known the benefits of PRP now for at least 10 years. And now adding exosomes is pushing it over the top. More anti inflammatory and more regenerative. And then seeing these secondary benefits, that might be really something to talk about.
Yeah. What I think I may have even mentioned this to you when I met you, but since I've been doing PRP, the results are the the ones that it works on, it's great. I don't
Mm-hmm.
feel like it works percentage wise as high as what they say for me. That's been my
Okay.
experience. What would you say is the difference with exosomes as like adding the exosomes? Do you feel like it just enhances it that much more? Do you just have that much, higher chance of success? What do you feel like it adds to the PRP?
It's that's that is the question. It's just anecdotal at this point, but one of the reasons that men do PRP, not only for erectile function, but it might be for premature ejaculation. It may be for the inability to sustain their erection long enough for penetrating intercourse. It may be for just not feeling sensation at all in the glands. So there are many reasons that men will do a P shot, and it's same for women. Women may want to simply enhance a good orgasm and make it great. As we age in women, we do diminish our ability to achieve orgasm as quickly as we used to. So it makes it a little harder to quite get there. Or it may just be, that was nice, but not hanging from the chandelier. So what we see with PRP is around an 80 to 90% satisfaction rate in men and women. That's my experience, generally speaking. And I think that kind of travels through for most doctors. But I do emphasize that not all PRP is created equal. We definitely have to have a decent concentration of 6 to 8 times, a simple single spin where you're only getting a concentration of 2 to 3 will not get those results. That I have definitely seen, having many systems that to produce PRP. I've been teaching and also doing it since 2014. So with that, I have definitely seen the higher concentration double spin PRP create better results of 80 to 90% satisfaction. And it would be in all of those, any one of those realms, whatever the patient was out to succeed. When it comes to exosomes, it's just easier to get there. And we're seeing the responses a little sooner. For example, PRP, I always say 3, 3, and 3. Once you inject PRP, you will have a clinical result almost instantly for the first 3 to 7 days. Is that a real change? No, that's a volume change. That's simply from having the extra fluid directly in the corpus cavernosus in both men and women. Then after that, there's a lull. You may say to yourself, why did I even go through that? I feel nothing again. It's gone. That was so much fun for that 1 week. And then it's gone. So some patients have to wait. And at around 3 weeks, they begin to see that regenerative tissue beginning to build. New nerve, new blood cells, new blood vessels, et cetera, et cetera. So at 3 weeks is when we'll begin to start to see some regenerative nature with PRP, and the maximum for that particular procedure will be at 3 months. And then that continues and on average lasts around a year, give or take a month. Okay. When it comes to exosomes, we are seeing results more rapidly and at around 2 months, with an even sooner anti-inflammatory wise.
Still lasting about a year on, would you say, on the exosomes?
Is that would be our hope, if not longer,
but we don't
being that we're seeing the response sooner and thus far out 6 months with no diminution of symptoms at the moment.
Okay. So obviously with men, we're going to see stronger erections, maybe increased sensitivity,
Yes.
things like that. Specifically for women, what can women expect,
Hmm.
with specifically with the exosomes?
All right. So when it comes to the, are we talking sexual medicine? If
Yes.
we're
Yeah.
talking, okay. Because I have exosomes in my hair, in my face, I use when we use exosomes for intimate health for women, it will cause improvement and enhancement of the orgasmic ability. Not only your ability, you will be able to achieve orgasm faster, but it will be more intense. So that it's always so difficult to literally quantify in a woman. But let's say she's able to easily orgasm before she has exosomes. Afterwards, she would be more likely to have the intensity go up, but also the ability to have multiple orgasms and to sustain that response.
So as we talk about autologous exosomes,
Mm-hmm.
there's not really any downside other than, I mean, obviously these are going to be pretty expensive, but other than cost, I mean, it sounds like they're safe. I mean, there's not really any downside, correct?
Correct. Because they're the patient's own. Just like PRP, we have seen no long-term complications of the use of PRP when done appropriately, except for the media right now with a clinic down in New Mexico. I don't know if you heard about that.
Mm-mm.
Well, there's a clinic in New Mexico, completely illegal
Mm.
and untrained, not appropriately trained. So any patients out there, if you are looking for any type of regenerative procedure with PRP and or exosomes, you want to know that your provider is certified and truly trained. You cannot go to a back street and
Mm.
get your PRP. This particular clinic was not labeling samples,
Mm.
mixed them up,
Oh
and
no.
gave several patients HIV.
Oh
So
man.
it's a, you cannot just go anywhere.
Sure. Yeah. Yeah.
Find a certified real provider.
So, where do you see exosomes, specifically this autologous exosomes, is are pretty new. Where do you see this in a year from now, 3 years from now?
I believe that this is the next frontier in overall longevity and health.
Hmm.
We know that allograft exosomes were used in heart attacks models in mice and regenerated that heart tissue.
Hmm.
The number one cause of death in this country is cardiovascular disease, heart attack, stroke, high blood pressure. If we can improve recovery from a heart attack where the heart tissue is damaged, we can prolong the quality of life.
Hmm.
So if we can diminish the inflammation inside a blood vessel that's causing plaque to attach to the wall and cause that progression of cardiovascular disease by using exosomes, we will be able to save lives.
Hmm.
So we have the ability nowadays to do incredible tests like the CCTA read by Clearly, which is a CAT scan of the cardiovascular vessels read by artificial intelligence, which stretches out every single blood vessel and clearly delineates exactly where that plaque is and the maturation of that plaque. Is it soft plaque? Is it calcified plaque? And where is it in that blood vessel? just on a note, my only plaque in my heart is at the beginning of my LAD at 25% occlusion. That's the widowmaker. It's very important to know it's time for my follow-up, and I have to see if by changing lifestyle, I have improved that or allowed that to progress.
Well, where can people learn more about exosomes, specifically these autologous exosomes? I don't think there's too many providers doing it. When I checked into it, I hopefully will be able to do this, especially in my new clinic. And if and when I start doing that, I'll be the only one in Oklahoma doing it. But where can patients go to learn more about this?
All right. So the company, there's only one in the United States. I'm sure there will be more, but at the time of this recording, there is one company that is able to provide these autologous exosomes in the United States. It is called ZEO, ZEO Scientifics with an X at the end. And the product's name is PPX. So PPX exosomes are autologous. The way we do it is when the patient comes into the office, I draw 60 cc's of blood, which is 4 tablespoons. I put it into a kit that ZEO sends to me for that patient. It's labeled and labeled and labeled again. It goes into a FedEx box, which is also supplied by ZEO, and you push a button in the FedEx box, it drops to -4 degrees Celsius, which is very cold. And we place the blood into that FedEx box. I call FedEx. FedEx knows, oh, Dr. DeLucia's got another sample. They rush over, pick it up within an hour. They're really on the ball. They pick it up and fly it immediately to Florida, where ZEO has a hypercentrifugal procedure. It goes out, the centrifuge is over 100,000 RPMs. It only takes 10,000 to put a satellite in the orbit, just to let you know. So crazy force and speed, which is why we can't just do this in the office. And the turnaround time is around 10 days when they will refreeze the product and ship it to my office within 12 to 24 hours once they have created it. I have a freezer in my office that is, again, at that temperature, and I may store that patient's PPX for up to 6 months and use it for whatever they care to use it for.
Very interesting. Okay. Well, thank you for that. And so if people want to learn more about you and your clinic, is the best place to find that at drcarolyndelucia.com?
That's it. Yes.
Okay.
And you can follow me on Instagram. I'm Carolyn DeLucia, MD on Instagram. And on Facebook, I am Carolyn DeLucia with a capital L, DE capital LUCIA, but no doctor and no MD following that on Facebook.
Excellent. Okay. And where is your clinic?
I have a clinic in New Jersey, which is my main location in Hillsborough, New Jersey.
Okay.
And I have an office in New York City.
Oh, wow. Okay. All right.
Yeah.
Well, very nice. Well, I appreciate all that info, and the lecture you gave was great, very enlightening. And I guess as we wrap up here, I always ask my guest if they could give us one health tip that could make us healthier today. What would you say to that?
I would say, honestly, I think one of the major deficits in the United States is vitamin D. So if you are not aware of your vitamin D level or you are not supplementing your vitamin D, I really suggest that. Is so simple to do, to take 2,000 to 5,000 international units a day, preferably with K2, is what I recommend. You're not only protecting your bones, but you're protecting your immune system and boosting it to improve your ability to fight off whatever comes around to us.
Yeah. Very nice. All right. Well, great information. And for those here locally, you can just be, kind of following me on Facebook. And when I start incorporating these exosomes, then I'll make some posts probably on here and Facebook and different places. So you'll know if that's something that you're interested in. So, all right. Well, Dr. Carolyn DeLucia, appreciate it so much and everything you do and for just sharing your knowledge with us today. Certainly appreciate everyone listening, and we will talk to you all next time.
Thank you so much.
Thank you for listening to FitRx. I invite you to share this with friends and family. If you would like to contact me, you can visit our website at fitrxwellnessok.com, or you can email me at drgreg@fitrxwellnessok.com.